There you go.
Hello everyone, my name is Ashley Stewart, student of occupational therapy at Trinity Washington University, and this is my trusty friend Jane Wild, who will be acting as my patient today, and on this bed that'll be acting as our mat. So we're going to go through some techniques for measuring the range of motion, which is defined as the amount of movement possible at a joint. We'll be going through active and passive range of motion for hip flexion, extension, and knee flexion and extension. And we will also visit manual muscle testing for those four joints as well, in the gravity, against gravity, and the gravity minimized plane. So we're going to get started first measuring the active range of motion and the passive range of motion of Jane's hip flexion. So for hip flexion, we'll have you come onto your back. So you can place a pillow underneath the patient's head just for their comfort. And the position of the therapist is standing at the side of the limb being tested. So I'm going to come down here, and first thing I'm going to do is just ask Jane, can you move your knee in towards your chest, just like as far as it'll go, and then have her bring her leg back out. Yep, you can straighten it back out and set it down. And then just so that her arm doesn't get in the way of the goniometer when we measure, I'll ask her to just move this arm. Can you just move it over your head, like put it on the pillow? Is that okay? Comfy?
Yeah.
Okay, so we'll go there, just so that the arm is out of the way. So for hip flexion, you saw the movement. She'll be bringing her knee in towards her chest, and for the placement of the goniometer, the axis is going to be right at the greater trochanter, so I can palpate for her greater trochanter. Can you just kind of wave your foot side to side, so internal, external rotation? So I can feel the greater trochanter right here. So I know that that's where I'm going to line up my axis. You can stop and just relax your leg. And so the fulcrum or the axis is lined up here at the greater trochanter. And then I'm going to keep my stationary bar parallel to her trunk and parallel to the surface on which she is lying. And then the moving bar I'm going to keep parallel to the lateral midline of her femur bone. And this is kind of aiming down towards the lateral epicondyle. So we'll start here, and I'll just ask again, can you move your knee in towards your chest as much as you can, so bending at your hip? And is that as far as you can go?
Probably because I got a bandage on my knee.
Okay. And so we'll measure her
Otherwise,
there.
I could get my knee up to my stomach. Probably.
Okay. Alright, so we're measuring right at 105 degrees, but she has a bandage on her knee and says she could go further if she didn't. So that was active range of motion, which is just defined as the amount of movement possible when the muscles are acting on that joint. Now we're going to do passive range of motion, which is when an outside source is the presence of that action, which I'll be that presence. So once again, we're just going to line up stationary bar parallel to trunk. Everything's the same. Can you move your foot again in and out just so I can feel your legs straight? Move your foot in and out a little bit.
Oh, in and out or up and down?
Perfect. That's good. So then I can find that greater trochanter. We're going to line her up here. Typically, passive range of motion, you get a few extra degrees because the person or the force pressing on the leg maybe takes the joint just a little bit further. So we'll see what we get here. Okay, I'm just going to bring your knee in. Is that okay?
Mm-hmm.
Is that okay right there?
Yeah.
Okay. And then I'm going to bring this back up. And I'll measure her here at 111 degrees. So she had 6 extra degrees from active to passive. So that's range of motion for hip flexion. Alright, so for manual muscle testing, the muscles that act on the movement of hip flexion, the patient will be seated when we're testing against gravity. So in this position, I will just first ask Jane if she can lift this leg off of the bed, so raising your knee up. Okay, perfect. You can put it down. So since she's able to move through that range of motion, I'm going to now apply a little resistance to test for her manual muscle. Great. So I'm going to stabilize here, and I'm going to apply resistance here at her distal thigh, so just above her knee. And so I'll ask you again, can you raise your knee up just a little bit here? And now I'm going to press down, and don't let me press your leg down. Awesome. You can relax. I would give her there a 3+. So moving to a gravity minimized position, can you lay on your side facing this way? So the patient position, and you can rest your head on the pillow if that's comfy. The patient position is side lying for testing, for testing manual muscle testing in the gravity eliminated or minimized plane. So for here, I'm going, if you want to straighten this leg, you can. This bottom leg can be straight or flex knee, just whatever's comfy.
Doesn't make any difference.
Okay,
whatever's
comfy. And I'm going to support her leg under the leg and knee right here. So first, I'm just going to ask, can you bring your knee into your chest? Okay, so she can. So since she's moving through full range of motion in the gravity eliminated or minimized plane, I'm going to apply just a little bit of pressure to see if we can grade her as a 2+. So again, I'm going to stabilize, just holding this leg, not moving for her, just supporting this leg. And again, I'll ask you to move your knee to your chest, and then I'm going to push on you here. Perfect. Okay, you can relax.
I can hear them creaking.
So I would definitely grade her there as a 2+. To measure hip extension, range of motion, we are going to have the patient be in a prone position. If the patient lying in this position has pain in their low back or discomfort in their low back in this position, you can put a pillow or a rolled up blanket under their belly, but Jane says she's fine like this, so we're going to roll with it. The position of the goniometer is going to be the exact same as when we measured hip flexion. So axis on greater trochanter, stationary bar parallel to trunk and surface, so the bed, and then moving bar parallel to lateral midline of the femur aimed at the lateral epicondyle. So for this, the movement is just going to be, Jane, can you lift your leg up into the air as high as it'll go?
My knee too.
And your thigh. Yep, lift, lift, lift. Okay, good. You can put it down. And so that's the movement. So I'm going to set the goniometer up here. No, ma'am. I'm just going to palpate for it here. Okay. Set and set. Make sure you guys can see. Okay. Jane, can you again lift your leg back up into the air as high as it'll go? Okay, you can drop it. And I'm going to measure her there at 10 degrees. We'll note that normal range of motion for hip extension is 0 to 30 degrees. And pertaining to the last segment in range of motion measuring hip flexion, we will note that normal range of motion for hip flexion is 0 to 120 degrees. So moving to passive range of motion for hip extension. You're going to set everything up the exact same. Always have to palpate for the greater trochanter. Okay, and this time I'm going to move her leg for her. Is that okay?
Yeah. It won't hang up there forever,
It's
though.
okay. I'm going to try and move this arm by my hand. It's a little harder than it seems. Okay, you can rest. And I'll measure her there at actually 8 degrees of range of motion. So for manual muscle testing, the muscles that act on the movement of hip extension, we are going to have the patient in the prone position.
What do I do with my arm?
Just whatever is comfortable. So in this position, the patient is going to be lifting their leg off of the bed for hip extension, or up into the air, I should say. And we're going to be stabilizing. Stabilizing hand is going to be right here at the iliac crest, and then resistance hand is going to be here on the posterior distal thigh. So first I'm just going to ask Jane, can you lift your leg up off of the bed? Yep, the whole leg, good, rest. And then I'm going to stabilize here and apply resistance here. Can you lift your leg a little bit again? We'll come halfway, and then I'm going to apply pressure. Don't let me push your leg down. Good, you can rest. Very strong. We're going to grade that as a 4. So now I'm going to ask Jane, can you come up and lay on your side now? And I'm going to get your pillow for you here. But can you come to the edge of the bed?
Yeah.
So to test for manual muscle, here for the hip extension and gravity minimized now, the position
I might
is
start snoring.
side lying. And so for this, we're going to bring this leg here, and same thing as before, we're going to stabilize under the leg, holding here. Again, just stabilizing, not doing any movement. And I'm going to say, can you move your leg this direction, leg back? And she's able to move through range of motion, so I'm going to apply a little bit of resistance here. Okay. And she was able to press against me a little bit, so even in gravity minimized there, I would grade her at a 2+. So for measuring knee flexion, range of motion for knee flexion, the position of the patient is lying supine, and Jane's head is supported by a pillow here, just for comfort. The position of the goniometer, the axis is going to line up with the lateral epicondyle, so you can kind of palpate and find that. The stationary bar is going to be parallel to the lateral midline of the femur bone, aiming towards the greater trochanter, and the movable bar is lined up with, or parallel to, the femur, and it's aimed down towards the lateral malleolus. So in this position, I'll ask Jane, first I'll just ask Jane, can you bend your knee and bring your heel in as far as you can go, keeping your foot on the bed. Perfect, you can come back down. Okay, so just to see that she can range there, now I'm going to line back up, and I always have to palpate to find these bony landmarks. Okay, Jane, I'm going to ask you to do the same thing again, bending at your knee, bring your heel in. And as far as you can go, keeping your foot on the bed. Okay, just give me a second. I'll measure her there, right at 128 degrees. So have you bring your leg back down. So that was active range of motion. For passive range, you're going to have the same position, and I'll just be acting as the force that moves the leg. So I'm going to bring your leg back up. Is that okay?
Mm-hmm.
And there I'm able to get 132 degrees for passive range of motion of knee flexion.